Sometimes when you sit still for too long in a weird position, your legs get all tingly and fall asleep? Or when you fall asleep on your side and then you're woken up by a burning sensation and your arm feels like it's being poked by a bunch of little needles? Why is that? Well, it is caused by a condition known as paresthesia, and contrary to popular belief, it is not usually caused by a lack of blood flow, but by your nerves being compressed and pinched. Although poor blood flow can cause it in more severe cases, which we will go over later in this video. Your nerves carry messages between your body and your brain, but if a nerve gets pressed, squeezed, or pinched for too long, like when you sit on your leg for an entire movie because you know the second you look away to get comfortable, that alien you've been waiting to see for almost 2 hours is going to run past on the screen and you're going to miss it. Anyway, those messages get mixed up and disrupted, and when the nerve gets released, it starts firing off irregular signals to the brain. That's what causes the tingling, poking, burning sensations we call your limbs falling asleep. For the majority of people, this sensation is uncomfortable and can cause some slight disruptions briefly to your day. We have all felt it, unless you're not normal. It might be a little painful, it might prevent you from using the arm or leg for a minute or two, but all those sensations will pass pretty quickly and they are not anything to worry about. However, there are chronic conditions and diseases that can cause paresthesia as well. Things like diabetes, or nerve damage, or vitamin deficiencies, or even something as severe as multiple sclerosis. This is where paresthesia caused by poor blood flow comes in, and it can be very, very dangerous. So even though it is far more likely you just squeezed a nerve for a while you were trying to sleep on that tiny uncomfortable couch, you should pay attention if it happens on a regular basis. It should not be that common in a healthy person. If paresthesia is happening all the time, or if it doesn't go away, that's a reason to check with a doctor, especially if it comes with long-lasting pain or muscle weakness. Needing to limp around your living room for a minute while your leg wakes up is normal, but limping around for extended periods of time or more than the extremely occasional occurrence is not. Don't hesitate to get checked out by a doctor if you feel like you're suffering from paresthesia too often. The doctor will be glad you're taking care of yourself. So to summarize, that pokey pins and needles feeling you get in your limbs sometimes is called paresthesia. It's generally harmless and more annoying than anything else. It's caused by the squeezing and compressing of nerves, unless you have a severe medical condition, in which case it can be caused by poor blood flow or actual damage to the nerves. Stay calm, don't freak out, but if you're having cases of paresthesia regularly or more severe than normal, go talk to your doctor. It might prevent a really bad outcome for yourself, and you might get a lollipop in the process.